that patients hear things differently. Patients may really receive information and act upon it depending on the way that they receive that information. Some people really like pictures. They like to hear about what's my chances out of 100 of having a condition or improving a problem. Some patients like to hear percentages. So I think we need to really be tuned into our patients and know what it is that might help to motivate our patients.
In the Cardiovascular Lifetime Risk Pooling Project, Jarett Berry and collaborators attempted to take age out of the Framingham Risk Score in a pooled data set of approximately 17 cohorts comprising nearly 500,000 individuals with risk factors measured at different index age. We asked him how physicians might be able to use lifetime risk estimates to influence people's behavior.
I think this is an incredibly important question, and if you think about it on face value, a 45-year-old man with several elevated risk factors has a lifetime risk for atherosclerotic disease of over 50%, but his 10-year risk is between 2 to 5%, depending on your risk factor levels. So the physician communicating to the patient could say, your Framingham risk score is low. Go on, continue on. We think that may be a bad message, and by saying, look, the difference between you and an individual with a truly optimal risk factor profile, that lifetime risk is markedly different. Compare 50% roughly to around 2 to 3% lifetime risk for cardiovascular disease.
We've done research in our own institution that has shown, for example, that older patients, those over 65 years of age, like to hear very simple information. They want to know numbers of risk factors or that they have unhealthy levels. Some individuals with a high level of education, I have accountants in my practice that want to know precisely what the probability is that they're going to develop a certain cardiac event. So I think it's important to understand that it's not a one-size-fits-all approach. Every patient is different and every doctor is different.